People were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz, and Acting Assistant Secretary of HHS, Dr. Dorothy Fink. So thank you all. Thank you, Dorothy, very much. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have, for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000 and then you go to 12, there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Yes. Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you can't tough it out, if there's a problem, you're going to end up doing it. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period. Take it over 5 times or 4 times, but you take it in smaller doses and you spread it out over a period of years. And they pump so much stuff into those beautiful little babies. It's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little child, little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And it's artificially induced. It's not like something that when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it. And that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact. So let those be taken separately. And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about. I mean, this was mostly going to be on how not to have the child affected, but we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can get better. And in some cases, maybe substantially better. Not going to be easy, but be a lot easier if it didn't happen in the first place, as these great parents fully understand, right? They fully understand. I feel so terribly I have so many friends with autistic children. It's a tough situation. Finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot. And I want to say it right now. And, you know, the way I look at it, don't take it. Don't take it. There's no downside in not taking it. So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on this subject for a long time. You know, life is common sense, too. And there's a lot of common sense in this, and I wish things like this were brought up. And this group has worked so hard on it, but I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quicker. There's absolutely no harm. At worst, there's no harm. Thank you very much. Bobby, please.
Thank you, Mr. President. To meet the President's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. We have broken down the traditional silos that have long separated these agencies, and we have fast-tracked research and guidance. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development. We have also evaluated the contrary studies that show no association. Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health. FDA also recognized that acetaminophen is often the only tool for fevers and pain in pregnancy, as other alternatives have well-documented adverse effects. HHS wants, therefore, to encourage clinicians to exercise their best judgment and the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required. Furthermore, thanks also to the politicization of science, the safety of acetaminophen against the risk of neurodevelopmental disorders in young children has never been validated. Prudent medicine, therefore, suggests caution in acetaminophen use by young children, especially since strong evidence also has associated it with liver toxicity. Some studies have also found the use of acetaminophen in children can potentially prolong viral illnesses. FDA will drive new research to safeguard mothers, children, and families. In addition to a possible acetaminophen connection to autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism. We have also identified an exciting therapy that may benefit large numbers of children who suffer from autism. Peer-reviewed literature has documented that up to 60% of folate-deficient children with ASD can have improved verbal communications if given leucovorin. I have instructed NIH, FDA, and CMS to help doctors treat children appropriately. Jay will help tell that story, which started with sound science, the kind that restores faith in government. This announcement also represents a historic collaboration between NIH, FDA, CDC, and CMS. We expect this to be the first of many announcements over the coming years that deliver actionable information to parents on underlying cause of autism and the potential paths for prevention and reversal. Finally, autism is a complex disorder with multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. President Trump believes that we should be listening to these mothers instead of gaslighting and marginalizing them like prior administrations. Some of our friends like to say that we should believe all women. But some of these same people have been silencing and demonizing these mothers for 3 decades because research on the potential link between autism and vaccines has been actively suppressed in the past. It will take time for an honest look at this topic by scientists. But I want to reassure the people in the autism community that we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find. We are researching this issue to all 3 agencies. Jay will discuss one of our research initiatives at NIH. This model of unleashing unbiased, depoliticized, gold standard scientific research and academic freedom to deliver actionable information to prevent and reverse disease will be a model for the framework to deliver similar results for many other chronic conditions that plague Americans. Jay?
Thank you, Secretary Kennedy, and thank you, President Trump.
Thank you very much.
I'm proud to announce today that the NIH has launched the Autism Data Science Initiative to turbocharge autism research, devoting an additional $50 million to the cause of studying autism. Nearly 250 research teams from across the country applied, sent in their applications, and were peer-reviewed by the NIH review panels. The NIH peer reviewers chose the.
So you were just listening there to President Donald Trump, as well as Health and Human Services Secretary Robert F. Kennedy Jr., discussing their new findings and their new recommendations that they will be making to physicians regarding the use of acetaminophen among pregnant women. Again, the president deemed this a historic announcement, and all of this is in conjunction here with the FDA as well. And so what we're hearing from the president is that the FDA will start to notify physicians about the use of acetaminophen that they believe is associated with an increased risk of autism. And this, of course, is use of acetaminophen by pregnant women. They think that pregnant women should limit the use of this. They also are going to be changing some labels as well on Tylenol. So I want to bring in ABC's Selena Wang at the White House there. And so, Selena, again, the president said this was a historic announcement. We know that from the White House that they said they're going to look through this with a different lens, and that they encourage an open mind here from Americans that will be watching this. But you have to imagine that all of this creates a lot of confusion now between Americans right now that are watching this, their physicians, and what we're hearing from the White House.
And doctors leading into this had been concerned that this announcement would fuel confusion and that mothers who are expecting would not take Tylenol when they have high fevers, as we know that these fevers can cause risks for pregnancies. And it was quite striking to see the president giving direct medical advice to expecting mothers, telling them not to take Tylenols unless they have a very high fever and they, quote, can't tough it out. And this is an announcement that we have heard the president himself teasing for weeks. The White House had been touting this as an announcement that would show historic progress on addressing rising rates of autism in the United States. Big questions about exactly what kind of data that they're using to back this up. But we did also hear from the head of the NIH talking about how they're going to make new investments to turbocharge autism research. And also, remember, Kana, earlier this year, back in April, RFK Jr. had vowed that he was going to understand and reveal to the American public the root cause of autism by September. But look, this is something that researchers have been looking into for decades. Scientists say that you cannot come up with a single answer on this in such a short period of time, Kana.
They're also cautioning the use of acetaminophen among young children as well in this. I want to bring in ABC News medical correspondent Dr. Darian Sutton, and I want to touch on something, Dr. Sutton, that Selena brought up here, because we know the president, again, as she pointed out, essentially giving medical advice to Americans, said that you should limit the use of acetaminophen if you're pregnant, if you're a woman, if you just can't tough it out. First and foremost, I think the concern here that they were looking into, though, right, is not the mother. The concern is of the fetus and what happens when you take something like acetaminophen.
And that concern was prompted likely from a recent study that was in collaboration between Harvard and Mount Sinai, citing an association between the use of acetaminophen or Tylenol during pregnancy and the outcome of neurodevelopmental complications. Now, important to note again, and I think that this is important to underscore, that this study was investigated in 2024, more than 2 million children, and when looking at sibling comparisons, this association was not found. And just to go back, because the president had shared a lot of direct medical information that was frankly incorrect, dangerous, and harmful, it's really important to understand that when you have a fever in pregnancy, that in and of itself significantly increases the risk of harm to mother and child, which is why the American College of Obstetrics and Gynecology recommends that pregnant mothers talk to their providers and also note that it is okay to take acetaminophen during pregnancy, especially in the setting of a fever. When we're giving information and giving recommendations as clinical providers, we are doing so to make sure that we can reduce the risk as much as possible, but there's no way to eliminate that risk. And when you're looking at the risk and benefit of something like a fever, an untreated fever that can go on to lead to complications in pregnancy, preterm birth, and a stillborn if your fever is high enough, and not treating that with acetaminophen, that can lead to harm. So it's so important to understand that when making decisions, as difficult as it already is today for pregnant mothers with the amount of information and misinformation that circulates around them, this is really important to understand that if you were to have a fever during pregnancy, if you were to have pain during pregnancy, it's important to understand the data has not changed. Acetaminophen, the active ingredient in Tylenol, still remains one of the most safest options to take in pregnancy.
So to follow up on a couple of things there, though, in terms of inaccuracies, we heard some from the president, especially regarding vaccines. But in terms of the growing number of autism cases that we're seeing in this country, the president did cite 1 in 31 across this country. That's a sharp increase, and 1 in 12, which is for boys in California. And on that note, Dr. Sutton, we heard from RFK Jr. as well, says essentially they'll be asking physicians to have these conversations with their patients where they would caution the use about acetaminophen. They would advise a low dose and a short duration use. So what's your take on that?
Well, that's actually the standing recommendations. If you look at the leading institutions, for example, the American College of Obstetrics and Gynecology, they recommend that when using Tylenol, you want to use the lowest effective dose for the shortest period of time. That is to make sure that you're getting the most benefit while reducing the risks. In terms of why the rate of autism has increased, now we've understood through multiple different studies, through data and analysis, that it's not necessarily that more babies are being born with autism, but more likely the increased awareness of autism, the decreased stigma, the increased likelihood of parents to get screening, and also the broadening definition of what autism is and what the reasons why we have the diagnosis of autism spectrum disorder. It's all of these reasons compounded with likely genetic factors, which studies have shown that up to 80% of autism cases are associated with genetic mutations, as well as possibly environmental causes that lead to the outcomes that we see today. Important to understand, it is so much more complex than a simple binary yes or no or a simple finite reason.
So, Dr. Sutton, can you play it out for us when the administration starts to encourage doctors to change how they think about it, if they are, but there's also going to be a safety label change as well here? How quickly does any of that happen, and how does that work? And if you're currently pregnant and worried about this, what do you need to be doing?
The safety label changing, that's work within the FDA, that would likely take a significant process, possibly months, even longer, in order to create a claim that would provide some increased level of risk. Important to note, the FDA has already reviewed the evidence associated with acetaminophen or Tylenol use in pregnancy and has stated that they have not found clear evidence that the appropriate use of Tylenol in pregnancy leads to adverse harm. This question was already investigated, and the statements today are not based on anything that is new. So I think in terms of understanding what to do as a pregnant mother, an expectant mother, leaning on the institutions that have guided pregnancy and have improved outcomes, such as the American College of Obstetrics, such as the American Academy of Pediatrics, leaning on that institutional knowledge so that you can separate fact from fear.
Separate fact from fear, especially if you're navigating this as an expectant mother yourself. Again, the president saying that the FDA will begin notifying physicians that the use of acetaminophen, in their opinion, can be associated with an increased risk of autism. But as Dr. Sutton there pointed out, it's important for every person to have those conversations with their own doctor. We're going to continue to monitor this, and we will bring you more information as soon as we get it. Selena, Dr. Sutton, thank you both for being here with us. We also have some news to pass along here about our parent company, Disney, ABC. Disney has now announced that Jimmy Kimmel Live will return to the air tomorrow. Last week, ABC indefinitely suspended the late-night talk show after the